Dr. Bill Adams here, and this is everybody's favorite show, No Spin Live, and we've got a great one for you today. We're going to talk about a new Philadelphia Inquirer article calls out textured breast implants, an urgent Brazilian butt lift warning, and Kim Kardashian under fire. And we've got some great expert panelists to share insights with you. Dr. Pat McGuire from St. Louis, Dr. Richard Baxter from Seattle, Dr. Dan Del Vecchio from Boston, Massachusetts. Last but not least, Dr. Jason Posner from Boca Raton. Let's get into it. We got a lot to talk about. So this first story, Pat, I'm going to start with you. This is the Philadelphia Inquirer. It basically is a story out of the blue, fairly one-sided, talking to some people and their plastic surgeons claiming textured breast implants should be banned. And so why don't you lead us off on this? There's a lot to discuss.
Yeah, we all know that there have been reports of a rare lymphoma in the breasts of women with breast implants, and the cases have all been with textured surface implants. And textured surface were used initially to lower the risk of capsular contracture. They're also used in shaped implants to try and hold the implants in place. This article, the surgeons say there's no place for textured implants. I personally like textured implants very much. I think the ability to control where the volume goes in the breast can be very useful on very specific patients if used appropriately. Not for everybody, not on every case, but the patients have to understand the risk and they have to understand the potential benefits. Those have to be outweighed. Now, I will say I have significantly reduced the number of textured implants that I've been using for cosmetic and reconstructive surgery to only those patients who will see a specific benefit. Banning them when you have some patients who really could use them, I think is a bit of an overreaction.
Yeah, I mean, Richard, to say that the implants all should just be banned because there's no clinical indication that they have any use for a patient is naive, don't you think?
Oh, right, absolutely. I think there are definitely specific cases where a shaped implant, and those are where you need the texturing. There are definite cases where they're going to get a better result. Patients with a tubular breast, for example, or just that tight lower pole where they really need, like Pat was saying, to be able to control where the volume in the implant is. I think it's a false comparison to just have patients in the OR and you put an implant on one side and on the other, and the tissues are tight, nothing is settled yet. You can't really tell the difference, and that assumes that you would use textured implants routinely anyway, or the shaped implants, rather than that you're going to just select them for specific patients. So yeah, let people know what the issues are with them, but also I think there are cases where you definitely do get a better result.
Dan, what's your thoughts on this topic?
This is just a paid advertisement, guys. I mean, do you think that the person who wrote this story did research and picked David Hidalgo, Eric Swanson, and Mark Clemens, because she made a bunch of phone calls and found out who were the biggest experts? Or do you think it goes like this? A PR person has a Rolodex of writers all over the country who they can pitch stories to. They pitch a story to Marie McCullough and say, hey, do you want to do a story? She says, yeah. I say, I got 3 plastic surgeons who are my clients. They'll all give you sound bites. They write the story. And this is the classic scientific news story that's cloaked, and it's really a paid advertisement. And we're going to see that later. When are we going to wake up and call it what it is? This is not science. This is a paid advertisement. People are going to read this, and they're going to assume that these are the 4 top surgeons in the USA for breast augmentation. That's the problem I have. I don't have a problem with the science.
So Jason, like you and I, we're probably primarily smooth implant users almost exclusively, but I don't know. I mean, what's your opinion on this deal?
You know what? As we said on this show before, I'm not a textured implant fan. You know what? Richard and I have a lot of discussions over this, and in Seattle and other places, we both like to use support mechanism like different kind of meshes when the breast tissue needs some support. Other doctors will use a textured implant to keep that implant in place. So I'm more a fan of a smooth-walled implant with some mesh rather than using a textured implant.
Yeah, I think those are all some great insights, and certainly I think that it's a misconception just of banning textured implants is going to solve the problem. It's not going to solve the problem. It actually, to me, indicates an incredible misunderstanding of the whole science that we know about the topic. And certainly, Dan, I think you're exactly right. There's a marketing component to this that's kind of made it a little dirty subject. But let's go to the next hot topic. This is on Brazilian butt lift. There's a physician advisory that came out by a joint task force amongst multiple societies that have been working to study this. We've actually got one of the people that's part of that. Dan, you've done lots of science and research on safety of Brazilian butt lift. We certainly all agree patient safety is great. This advisory is about patient safety. But then there's kind of the story behind the story, I think, and that's that there's been press releases that have come out of people trying to market themselves as I'm the safe surgeon, which is a little bit problematic. And so, Dan, why don't you lead us off on this one?
Look, the brief 30-second is, for 2 years I've been on the podium speaking and writing about why we shouldn't put fat in the muscle. And it's taken several years and scientific presentations, and now everyone's jumped on the bandwagon, which is great, and I'm really happy about it, that surgeons no longer inject fat in the muscle, or at least the societies have now put out this urgent warning that you shouldn't place fat in the muscle. And that's a good thing. The thing that disturbs me is the abuse of the media, and it's the same formula that we just saw. A public relations firm is consulted, paid money. That public relations firm has long-term standing relationships, just like in real estate, law, and what we do, relationships with staff writers for newspapers, magazines, calls one up and pitches a story and says, will you do this story on XYZ, patient safety? They say, that's awesome. So last week alone, ABC News, Miami News, another press release in the Buffalo Daily, all about how top surgeons all over the world are now putting fat in the subcutaneous space with sound bites from people, some of whom have never done the operation. Is it right? It's not illegal. Is it ethical? Questionable.
Richard, where do you stand?
Up here in the Northwest, we haven't had the demand for the really high volume Brazilian butt lifts anyway, so I've always gotten away with doing the subcutaneous layer, so I've managed to stay out of trouble for that reason. But the reason this story is out there is also the fact that people have gotten into trouble with it, and so at least raising awareness within the society, within our peer group here of what the best techniques are for this, I think is important. Like Dan was saying, when it kind of spills out into a big general media story, that's where things kind of get out of hand. Patient
safety is our number one priority, and pretty much everything we've been doing, and all you guys educate all the time, and it's all about patient safety. And the advisory is a great patient safety piece. The problem, I think, is when people dovetail onto that and basically market themselves, then it becomes, they're basically taking something that's good and kind of turning it around. Some of the things that I've seen are really unethical almost. Pat, what do you think?
Well, I think the one good thing out of this story is the way the society has worked together and gotten people like Dan and the leaders in our society together when a problem came up. I mean, there have been 10 deaths from this procedure in Florida and in New York, and decided, we're not going to just let this sit back. They got people like Dan to go down and to see what happened. They've been on autopsies on some of these patients and have not just waited to see what was going to happen, but kind of worked together. And it shows you the importance of going to a board-certified plastic surgeon, members of the American Society for Aesthetic Plastic Surgery or American Society of Plastic Surgeons, because our societies really do want to make things safe.
What say you, Jason?
Everything I learned about butts, I learned from Dan. Dan works here every once in a while. So in this office, Dan will do the high volume cases, and I'll do some of the more moderate volume cases that more get lipo and want their tissue, recycled a little bit. But, I learn from Dan. Every time he's down here, I learn some little trick from him about butts. But I've learned all my techniques from him, and from the safety guidelines, again, everything from Dan. So my hat goes off to Dan.
I think that's a great thing to end on. And let's move to our next topic. It's a little lighter topic. And this is about Kim Kardashian. Apparently she posted on, I think it was Instagram or one of the social media accounts, of a picture of her in the past, like say 10 years ago. And she got a bunch of flack from viewers and posters saying that she had had so much plastic surgery and look how much her face had changed. I kind of found it a little comical, but Jason, lead us off.
I looked at my headshots, and one of the reasons I got my eyes done was my current headshot was terrible. So I think, look, we all have to be fair and use current headshots, but I had my surgery done because, you know what, I wanted some more recent photos. So it's not fair to use 10-year-old photos for anyone. And if Kim posted a 10-year-old photo of herself, then who cares? Her plastic surgery is tasteful. The girl is beautiful. I don't really consider her an outlier in terms of getting obnoxious done. So whether she had plastic surgery or not, it's been very tasteful. And post your old photos, post your new photos. She's a beautiful girl.
Pat, who doesn't look different 10 years later? I find it a little comical. People are throwing darts at that.
Yeah, if you look at a picture of me from a week ago before I had my neck lift, I looked a lot different than I do today. So, pictures change. We all age. We all, I get Botox, I get fillers, pictures of I hope I look like my picture from 10 years ago. But we all change, and Kim Kardashian didn't claim she didn't have plastic surgery, didn't do anything. And as Jason said, she's a beautiful girl. She's had, I think, whatever she's had done has been very well done. So good for her.
And Richard, I don't know who these people are that are saying this is a negative thing, but who doesn't want to look better? This is not like 1920, right? When you started getting older, and then pretty soon you go to the store and nobody recognizes you because you look so old. We have some things now that are very easy and you can look better. Who wouldn't want to take advantage of that? We're not driving, the Model T anymore either, right? We got cars that actually can drive themselves.
Yeah, sure. It's a normal and healthy thing to want to look your best and to want to look younger. That's human nature, and people are rewarded for that. People are rewarded for looking younger. What I find interesting is sometimes these articles talking about some celebrity, and they'll show a before picture or what they think is a picture before, and then they have some expert say, well, look, I think she might have had this work done. And it's like they're accusing the person of having had plastic surgery like it's some sort of crime.
Kim Kardashian may be the only person on Instagram with more followers than you. So, what do you think about this?
I think Jason's right. Look, the more I look at all of this, this is all about media attention and content. This is all BS. We get caught up in via ALCL and safety of patients. Nobody cares. At the end of the day, the media doesn't care about that. They just care about the sensationalism of the story, and they're on to the next thing. And we're just like enabling the media, and the people who win at this are the people who can pull the puppet strings and pay at the right time, the PR people, to get the story of the day. Tomorrow it'll be something else. Next week it'll be something else, and they just ride the wave. And frankly, as a surgeon and as a physician and a scientist, it's like not what I went into medicine for.
One of my mentors used to say, thank God for plastic surgery. I say, thank God for Plastic Surgery Channel, because at least Plastic Surgery Channel on No Spin Live tells you what the truth is, and you can sift through. For people that aren't, part of the whole game, they have no idea because it looks pretty compelling, but we tell it like it is, and thanks to you guys, this has been a great segment. So thanks for all those great insights. If you want to see more of this, you can see it on theplasticsurgerychannel.com.